Hi and welcome everyone. PAPANA Research Committee has arranged this research course for beginners with a series of webinars, and the course is conducted under leadership of our experienced and amazing mentors in research who have accomplished themselves in research both nationally and internationally, Dr. Mujeeb Shad and Dr. Sadiq Naveed. So today's session is conducted by Dr. Mujeeb Shad, and the topic is how to draft an abstract for conference presentation. And I will welcome Dr. Shad. Yes, please.
Thank you so much, Fauzia, and thank you for organizing this. This course was planned a few months back, but because of the interviews and the residency procedures going on, we were not able to do it. So now is the time that I think Dr. Sadiq Naveed Sadiq has already given the first one on how to formulate a research question, and this is the second one, which I'm going to talk about how to draft an abstract for a conference presentation. So without any delaying further, let's begin. So even before I talk about this slide, which is extremely meaningful for me because, you know, why do we write? Why do we read? Why do we learn? Why do we teach? So this is a very old saying, which actually says that I'm trying to move my, yeah, hold on. Yeah, it actually says Francis Bacon was a scholar many even century back, and he actually said that I quote, "Reading maketh a full man, conference a ready man, but writing an exact man." That is why writing is one of the foremost scholarly activity which you can perform and learn from it. I will add teaching to that too, because when you teach, you develop skills and you have to, there's some low level of anxiety, and you have to study hard, and you try to remember things which probably in usual circumstances you might be absorbed in your cell phones and talking to and seeing the post and talking to friends, which is very common these days. So teaching is one of the most important scholarly activity in addition to writing, and these two actually go hand in hand. Before I start, let me ask you this: anybody knows what is the meaning of abstract here? What abstract are we talking about? Is this the abstract from the mental status, or is it an abstract in a layman terminology? What is it, or what is the scientific abstract? So I usually have very interactive session, but because of the time we cannot have that. So I'll explain it to you because we should know what it really means. I think a lot of would know that abstract is a very high order cognitive function. And this function is actually completely mediated by the higher cortical centers, especially the dorsolateral prefrontal cortex, with some help from the motivational and from the cognitive other centers of the brain. And abstract is actually, if it probably makes you understand better if you create a contrast. Abstract is opposite of concrete. That's basically what it means. Abstract is deducing meaning for something which is not that clear. And in research, I think the idea behind having an abstract is that, in research, especially in brain research, we are not very clear about the mechanisms, the neurobiological underpinnings of psychiatric disorders, the pathophysiological explanations for diseases, and I think that is perhaps one of the reasons, but it is across the board. So we cannot argue that psychiatry is only applicable to psychiatry. But without further putting more time into this, I think this is a concept which we need to really know, and that gives you some sense of why we are doing it. So reasons for not writing. I have come across many medical students and even residents who actually are very reluctant to write something, and because they think that they are not capable of writing, and they don't know how to start. They So a little bit of guidance is essential, regardless of whether how intelligent you are, how smart you are, how resourceful you are. There's always this level of mentorship and a little bit of supervision and training, which actually gives you skills to do this. Then there is anxiety and there's lack of confidence. What am I going to do? And you are afraid of being ridiculed, that I write something and my supervisor is going to say, "What have you written? This is not worth it." But that happens to everyone. I'll tell you very briefly that when I started writing, I became extremely disappointed, but I had the resilience and the courage to continue. And despite having so many negative feedbacks on what I write, I continued. And now, at this level of my age, I think things have become so easy that you ask me a topic, and I can perform in a relatively much shorter period of time. I write something. And that is absolutely correct about abstract, because abstract is not that easy, but it comes with the experience. So the objectives are going to be, what is an abstract? I described that phenomenologically, but in terms of scientific presentation in a conference, we'll talk about that. Why to write it, how to write it, who writes it, who reads it, and what are the different types of abstracts. Because remember, abstract is not a monolithic concept in scholarly activities, and there's so many different way you can write an abstract. It all depends upon what is the reason behind writing the abstract. So we'll talk about that, what to include and what not to include. We'll give you some samples, which is actually the highlight of this presentation, because doesn't matter how much I teach you about how to write an abstract, unless I give you some example. And even better is like, if we can work together and you can write something and I can review it and tell you what are the problems and how can it be improved. There's nothing like that, because hands-on training is the best way to learn this. But anyway, we are beginning, so this is basic. Okay, so what is an abstract? It is a very crisp, very clear, uh, understandable synopsis of a poster. We are talking about a poster abstract. We are not talking about other abstracts. There are many other type, and if we have time, we'll look into those. At least I can tell you how many different papers and general sessions and presentations and reviews and meta-analysis have the abstract as well. Research project funding application, I think some of them I've described here. The abstract can be one single paragraph or with subheadings. So I think you will find that when I'm sure some of you are thinking about writing a APA abstract. APA abstract, I think, as far as I remember, does not have any headings, subheadings. So there's only a single paragraph. So you don't have to worry about the headings, the subheadings for the APA poster. And the abstract font size is different to the main text if you're writing for a paper. So the abstract, you will see, you can right away look at published article, and you will see that abstract, to make it distinct from the rest of the text, you see that it is in different font. But you can do that in the poster as well. It is original. It is not merely quotations or the cutting and pasting from what you're trying to do. That is not accepted. And it is a very important point about abstract is that it is a stand-alone document. So you have to really, really make sure that if somebody who is completely naive about your project, and if they read it, they will understand what you are trying to do, right? But if they don't understand, they are not going to read it. They are not going to go through your poster even. They will stop by your poster and then walk away. So it is a stand-alone document. And in that context, title is also very, very important. And we'll talk about that. But abstract, a lot of people come and see the abstract. And if the abstract does not make any sense, they are not going to go further. So this is a stand-alone document in which I think I can say something in Urdu, darya ko kuze mein band karna. So it's not an easy job to do, because you have to make sense out of maybe 7 to 10, 12 pages review or meta-analysis. You have to make sense in few words, that the people can be attracted. So title is the next one. The title should be short, attractive, and meaningful to make it attractive, just I said before. And so somebody can stop at your poster. The limitations usually is 150 to 250, but APA allows 3,000 characters, which I'm not sure, but it may come around maybe 300. It may vary, and maybe close to 300. And they also allow references. A lot of abstracts are not the conferences and publications and papers and articles don't allow references in the abstract, but APA does. Some do. So this varies across the board. Okay. Now, why do you want to write an abstract? Because eventually, going through the hardship of writing an abstract and sometimes being criticized, which is sometimes taken quite negatively, although that's not the purpose of the mentors. You Once you get this job done, really it feels good. I remember when I wrote my first case report, I just saw my name in print, and I was at the top of the world. I said, this is what I'm going to do. And since that time, it's always this burning desire that you want to write, you want to see your name in print. And there is a little narcissist sitting among all of us, which needs to be satisfied sometime, as long as it is not pathological. You can easily get intoxicated with research and scholarly work. Um, you know, there is a common expression among researchers, that once a researcher, always a researcher. That is absolutely right, because it is some kind of benign addiction, I would say. Um, Maybe it's your name, maybe it's recognition, maybe people talk about you and then talk to you, what a nice paper you have written. All those things, I think, are creating this feeling of feeling important, having self-esteem and increasing self-worth, right? So in addition, I firmly believe this, that if you do research, you become a better clinician. There's no doubt about it, because when you are doing research, you're doing brain exercise. And when you do brain exercise, you're developing new synapses. And when you are developing new synapses, you kind of develop kind of a cognitive skill, where you remember things more, where when you are presenting, things come back from the past and you mention them, and people are impressed that how you create relevancy in terms of research and clinical work and so forth. There were so many things you can do. I feel at this age that when I talk about something, often I go on a tangent, but as long as it is controlled, you can bring in an anecdote from your experience. You can talk about something you did in the past and make a relevance there. This synapses, the increase in synaptic connections between neurons, is the essence of writing and teaching. Why to write an abstract? So other reasons are, obviously, all of you would know this, that you want to crystallize your research project, or whatever you're doing. You're doing a review paper, you are doing a case series or case review. You are actually crystallizing your thought process. And then you want to get into residency, and that is actually one of the main reasons why a lot of you might be attending, is because you want to optimize your CV. You want to have some abstracts, posters, and hopefully some articles, and review papers, and actually, ideally, some meta-analysis. And you want to have more chances of a very highly competitive field of psychiatry, which is becoming very difficult these days, especially for the IMGs. You want to get a better job. So it does not stop there. Your CV is your reflection. Your CV is looked upon by the people you hire. They hire you, especially in academia, and they are going to give you some really good breaks in your clinical work, so you can do continue research. Sometimes there are studies available. You can be a part of a major research group, and they can support some of your salary. So forth. I'm not going to discuss all those things, but just to give you an idea that this is a path to success. So why to write an abstract? Some of the other things which I wanted to very quickly tell you, because time is running out. To persuade the reader to read full text or poster, we already talked about that. So this is probably redundant. So this is a pyramid, which I'm sure you have seen before. So this pyramid is actually tell you that what part of portion of this pyramid an abstract can represent. So you see so many things here, right? So this pyramid starts from in vitro research. The reason why it is at the bottom is because in vitro research is considered even sometimes by some researchers even lower than animal research, because it is in vitro. And in vitro, you cannot create a living environment. It's in vitro, but if nothing is there, it's worth it. Animal research, every clinical trial which is requested by the FDA to get a molecule approved actually involves animal research in the beginning. So that's more important. And then you have opinions, editorials, ideas, case reports, case series. Case control studies are better. And then cohort, prospective studies at the top, because those are the best. And then at the top, there are a couple of things which actually say what kind of clinical trials have the best research design. And that is randomized controlled double-blind test or trial, which is the best design. And FDA only accepts those kind of trials to get a drug approved by a pharmaceutical company. And then systematic review and meta-analysis is something which really need to be very familiar with. And if you look at the agenda of this course, that we are going to talk about systematic review and meta-analysis. Some other speakers are talking about it, and I think it will be worth watching. And a lot of times our residents actually create a poster for a review, and then you need abstract for that. So that is going to be the main idea behind this presentation, that we'll talk about the abstract poster, because just that's very highly relevant to the audience today. This is a poster, different headings of a poster. So I'm not going to spend, because the next lecture we are doing is on poster. So verb using the grammar is extremely important. And verb actually is one of the most pivotal part or a crucial part of an abstract. So when you're using a present tense to describe, and as opposed to using a past tense to describe, you should be careful about being consistent. A lot of times you may have to switch from one to the other, and there are several examples of that you can find in the papers. So, but verb is extremely important. Read it again and again. See if it makes sense to you. And one point I didn't tell you in the previous one of the slides, which actually give me this idea to tell you, is that since you have been working on an abstract, right? You know in and out of what you are doing. You have read papers, you have spent so much time to learn about the topic which you are presenting on, right? But the others may not have seen anything. So it is a best idea to give your abstract to be read by even a lay person sometime, and ask them, does this make sense to you? And then your colleagues and your peers, please remember this, because this is extremely important. You won't believe how much positive feedback or negative feedback you will give to improve your abstract. Okay. The title needs to be crisp. I'm repeating it again and again. If you can use Microsoft Office, some of you may not have access to it and prefer using Google Drives. That's fine, because that can easily be converted. I am a little conventional old school of thought, and I have always use Microsoft Office. I feel very comfortable with it. So if I'm mentoring people, I ask them to please use the Word documents. It becomes easier for me. If there are multiple trainees working on a topic together, uh, you should designate a leader or a point of contact person for each team so that there may be a better communication rather than having a random kind of communication and everybody getting confused. It's a very important part for being a member of a research team. Um, and each trainee sending a text or email may not be time efficient in relation to what I was just saying. So what do you do? For example, if you're writing a review, the first thing is to identify what are you planning to write, right? If you're writing a review, you're going to for empirical studies, for reviews or meta-analysis or theoretical papers or methodological papers or case studies, you have to do background research. Background research, there are so many courses available these days, and I think during this course that will be addressed as well, is to how to do literature search. Believe me, don't take it for granted. It's not easy to do valuable, valid literature search. You have to learn. You have to really, really know how to do it, because it's not that easy. Let me tell you that, even for me. So for us, for search, literature search, you just select a topic, you develop the tools of argumentation. So for example, you want to look at the neurobiological correlates of self-awareness, which I have studied a lot in my life, using functional imaging. Your topic is selected, right? But then you look at the existing literature, and you want to see where there are gaps, where you can improve the knowledge, where you can improve the understanding of self-awareness, right? And so that's what the argumentation mean, that you review the literature, and then you find out how can I improve this knowledge, how can I make sense out of so many different studies, combine them together, and talk about them in a new way, or maybe create a new hypothesis or research question which people will really appreciate and you might use for your future research studies if you become a researcher, right? So search the literature, survey the literature, critique the literature, very important. And my friends, I think will say Dr. Shad is talking about just being a researcher and invest so much time in these activities. But let me tell you, if you don't know how to critique and review a research paper, original research paper, you cannot do this. Because I hope that you are attending some original research journal club in which original research papers are being reviewed. That gives you the ability, and just not just a review of the abstract or the introduction or the discussion. No, methodology. There needs to be somebody in that room who knows a little bit about the methodology, so they can inform you that the methods used in this study were valid, were applicable or not. Remember, without that you cannot even write a good review paper, because if you cannot critique a paper, you cannot write a review paper. So this is a tough road. It's not that simple. So you have to learn not only how to do the lit search, but then learn how to critique an article. And I have a new residency program. I've already started journal club from the day one, and residents really appreciate that. These are the search engines. I'm not going to spend time on this. All of you would know. Now, how to write an abstract. So basically, some of the major points here are that you have to create your own style, right? And the creating your own style requires a lot of hard work. It's not going to come with writing one or two abstracts or papers. Your own style will develop over the years. It does not come in a short period of time. I have developed my own style. It used to be extremely difficult for me to find transitions from one research idea to the other in a paper or an abstract. Now I just do it like a uh, like my second habit. I just don't. I have developed skills where I can easily make a connection between two different points of view, or arguments, or thoughts or sentences, right? That comes with, so that's one type of thing which I will give you an example of, that you create your own style, you learn, and you learn how to write different types of abstracts, and we will look at that a little bit. So don't take it easy, it's a lot of work. And I think the others I've discussed. So these are some of the major kind of things which you can remember easily. So these are the 4 C's abstract writing. One is complete. So it covers major part of the project, although there's a word limitation, but you try your best, right? You try your best. Again, another thing which you will develop with your experience and develop your own style is how to minimize the word because initially, I think it's a free writing. If you understand free writing, it is just putting your thoughts on a piece of paper or computer. Don't think about word limit. Just put everything there. And then the pruning starts. Just like the pruning which happens in early teenage years, and the brain becomes more efficient in adolescence. This pruning actually works very well to bring all those different thoughts, free writing together, and then you can work on it. It should be clear, it should be concise, because obviously there's word limitation, and it needs to be cohesive. The transitions between different ideas, between different things you are discussing, has to be really quite well written, because otherwise people can easily get confused and they are not going to read it. Read your abstract all the way through. Let your colleagues, even lay people, read your abstract. So again, same thing. If it's a paragraph, the word limit is the same, 150 to 250. API, just told you, is 3,000 characters. So basically all those things. And I think I can skip this one for sake of time. Yeah, subheadings. So this is important. So the subheadings of an abstract, we already discussed, can vary based on what kind of abstract you're writing. And I'm going to give you at least the name of different type of scholarly writings in which abstract is required, so you have an idea. And believe me, every one at least slightly differs from the other. You should know the subheadings. There is, I think even the APA actually, they actually don't require headings. But let me give you a better answer. There are a lot of journals. If you are publishing a paper or a review, their guidelines are available online, and you can go to the author's instructions and look at them. So this is something which you will say what Dr. Shad is talking about here, because it is out of appears like a non-related bullet point, right? No, it is extremely well related. Believe me, I've gone through this. With your, you have to have a very clear, transparent, honest relationship with your mentors. Believe me, you will be really lucky if you get a good mentor, because mentors can make life and careers, and they can destroy them too. And unfortunately, there are a lot of them who do the second one. It's very difficult to find a mentor who is sincere, who really wants to help you and have a passion himself or herself to help research, promotion of research, right? So the thing I'm trying to say here is that sometimes beggars can't be choosers, but you have to really select the mentors which have good reputation, which really have helped people in the past, and they may not be available at times. So you do the best, but be assertive. Uh, you know, if you need time with them, be assertive. Look, you asked me to write this abstract. Can you please review it, because the deadline for submission is coming? That's what I'm talking about. Okay, so we are repeating this. May have separate sections or be a single paragraph. Okay. Title. So the title is the face of your abstract and the poster as well. And the title is where everything starts, right? If the title is confusing, for example, too lengthy, I've seen titles filling 25% of the poster area. That is extremely unadvisable. It's not the way we should write abstracts. Try to minimize the words in a title as much as you can. And believe me, I'll give you some examples here. The more crisp and short and brief to the point title is, the more likely people are going to stop at your posters. Bad example is the important role of developmental, environmental, and genetic risk factors in the etiology of schizophrenia. Very long, right? What can you do? Biopsychosocial risk factors in schizophrenia. How beautiful is that, right? It says everything. Introduction, background, purpose, whatever the requirement may be for different conferences. So I apologize for the typo here. The S should not. It's a general statement. Okay. So introduction starts with a general statement, and I'm going to give you some examples, because otherwise, you will say, what general statement? How do you write it, right? So I'll give you some examples. The introductory sentence, the general statement, may be stated as an hypothesis, depending upon your project, a purpose, an objective, or as a current evidence for a finding. It can be any one of those. Hypothesis is extremely important, but when you're writing case reports, case series, reviews, you don't need a hypothesis. Hypothesis is as an essential feature of research, the randomized controlled trials, as I was discussing earlier. So hypothesis is not required here, but in a research study, yes, definitely. If there are previous studies done in that area, you can easily formulate a research question and convert it into a hypothesis. Objective. So I'm not going to elaborate on others. Report deficiencies. So when you are doing introduction, what is your main goal of doing an introduction? Besides reviewing the literature and putting it down on a piece of paper, right? What do you want to do? You are going to report deficiencies in the previous literature. That's the whole point you are making, to do it afresh. Unless you tell the audience, oh, this is the information available, and I am doing this just for sake of fun. No, it doesn't work. You have to tell the audience that these are the deficiencies in this line of research, and I'm going to do this, and this. Never forget that, because that's the most important part of your introduction. And the most important other part of your introduction is at the end, if it's a research study, you base your hypothesis based on everything you said earlier, introduction. That is the essence of your introduction. And a lot of times, when we do journal clubs, people ask, where is the best place for hypothesis? That is the best place, at the end of introduction. Sample. So this is a kind of a general statement, okay? Where the introduction begins. Treatment refractory depression is one of the most expensive medical disorders worldwide. Due to direct and indirect costs associated with it, as well as loss of productivity during the illness as well as loss of life due to completed suicides. So the reader understands what is going to be your area. If they are interested in decreased productivity, if they are interested in suicides, if they are interested in, in treatment refractory depression and the cost it bears, they will definitely stop, and look at your poster. And of course, your title and your abstract is going to be reflective of that, right? So that's how you start a general statement. And then, it can follow what are the studies. For example, you can say, in following to this sentence, as a follow-up to this sentence is, although there have been a lot of studies to look at the consequences of treatment refractory depression and the cost associated with it, we have found that there are no recent reports available determining the cost of treatment refractory depression. Our goal is to investigate if there are any other new or current literature available associated with cost of depression. We want to review that, and that's why we are writing this review. That's how you do it. Methods. Methods, I repeatedly say that this is one of the most important, but believe me, everything is important. And the title, the face of your abstract and the poster is the first thing which people are attracted to. But people who really know research will actually go and read the methodology and will criticize you for it if there were some flaws or some weaknesses. And you should be able to defend them. If you are presenting a poster, it's not an easy job. You need to know in and out of your poster. When you go for interview, I'm a program director. This is my favorite question. I ask the residents, you published this poster. What did you do? What were the findings? What are your thoughts? And if you don't know, you're never going to get into my residency program, because it is obvious that you have got the poster just name in and you didn't do anything, right? So my friend, this is extremely important, okay? So I'm not going to go, because we are running out of time, one by one, but I just wanted to show you that use the search strings very effectively and formally, so that, I've given an example here: schizophrenia or psychosis and NMDA or encephalitis. One of my mentee, actually few of them were working on this. So I just put it there just to give you results. If you have a hypothesis, then the main part of the result is that you have to mention whether your hypothesis was confirmed or rejected. Don't go on a fishing expedition. Don't report something which was done post hoc and take credit for it. You can write it down as long as you say post hoc. These are very important points in result. But if you are doing a review, you talk about how many studies were found, what were the eligibility criteria, and how many of them you screened and selected for the review. That's the basic kind of initiation of a result section. And then the best thing is to create figures and tables for the poster, because in abstract, you don't have enough time, enough space. Always remember, if you're doing a review, always create a table. And the table creation is actually happens first in the process, because table, you cannot imagine how helpful a table will be to help you write all the different parts of abstract. Just try it. You will see what I mean. You can make your poster colorful, but not manic. Too many colors, too many bright colors, and confusing the readers and the audience. Use them with some color matching kind of thing, but use them effectively. They're pleasing to your eyes and attractive. Conclusions. Conclusion is another a very important part, and a lot of people actually look at the conclusion and walk away. Why? Because they either are not interested in that topic, or either they don't believe the findings, or either they have problems with the conclusion and they are from a different school of thought, right? So you have to be extremely careful to be extremely neutral when you write conclusion. Not only neutral, but you have to be you cannot write a conclusion like the example I'm giving you. Our review confirmed the findings, the neurobiological substrates of self-awareness in schizophrenia patients. You cannot say that. You will say our findings give us an idea about the neurobiological substrates of self-awareness. However, future studies are required to confirm these findings. You're just very humble. You write with humility. In research, there is no hard-headedness, always flexible. References, you can give 3 references in APA post abstracts. Yeah, that's what I. Acknowledgements, you may have seen some acknowledgements in some posters, so please use them when somebody is really help you. Your mentors who were not very actively involved but still helped you. Funding sources, extremely important if it was funded. So these are different types of reviews. How much time, Fauzia, I have?
We have time. Please continue.
Okay.
Yeah.
Okay. So these are the different types of reviews for which you may want to write an abstract. They can be argumentative review, in which you actually selectively review the literature to support or refute an argument. It is embedded in assumption or philosophical problem already established in the literature, but you want to challenge it because you have different point of view. Then there are integrative review, in which you actually synthesize the selected literature on a topic in an integrated way. You bring things together, you make sense out of them, that why this might be the finding from this study as opposed to the other study, and what's going on, right? Historical review is pretty self-explanatory, that you're looking at some historical phenomena emerge on the basis of your review of the literature, and then you want to talk about it. Methodological review are really the good ones, because you're looking into the methodology of studies which you reviewed, and you want to comment on that. For example, the content, the method of analysis, how relevant the statistical analysis was, and the power analysis was, how relevant was the design of the study, whether it was the optimal design to answer the question of the study you are doing. Okay. Now, the type of other type of reviews are include systematic review, which I'm sure all of you are familiar with. So I'm not going to spend a lot of time. And besides, I think we have a course, one part, the part of this course includes that a review of systematic, a talk on systematic review. And systematically, basically, I just wanted to tell you, systematic means that the methods used to search for and to analyze the data are transparent. You're open, honest about everything in that. Reproducible. So for example, if you document a lit search produced 500 papers, and you provide the literature string in your paper, anybody using those words should get the same number of. Don't have shortcuts, okay? It's going to come and hurt you. Theoretical review. Concretely examine the corpus of the body of theory that has accumulated with regard to an issue, concept, theory, phenomena, creating new hypotheses, new models, new strategies. That's all theoretical review. Scoping review. I think it's becoming more popular. We wrote an scoping review as well. And I want to write more because scoping gives you kind of a unique position where you can assess the potential size and scope of available research literature without having rigid rules and regulations as you would expect in meta-analysis and systematic review, okay? A rapid review is nothing, but it is a kind of a more relaxed systematic review, nothing else, for the sake of time, okay? Now, meta-analysis, I'm not going to talk a lot about because there is a part of course which is going to address that. But narrative review is another one you might come across quite commonly. It's basically narrates, it's primarily a qualitative paper. You're not talking about numbers and things, although you do because you have to put references there. But basically narrative, you can do quality, you can as well quantitative as a second thought, yeah. But mostly you talk about reviewing literature, which is very comprehensive and critical. So you can use this form for a critical and objective analysis of the current knowledge, and then meta-analysis. And there can be a mixed. I've seen papers who actually use meta-analysis and and systematic review on the same paper. So that can be done. This is, I think, we have touched on a little bit, but there is a Pickering method. You can look more on that for systematic quantitative literature review. So that may guide you a little bit better because people use sometimes this Pickering method. Scoping reviews, I think I will skip those. There is another type of review, which is two types, which is one is called descriptive abstracts, or not, sorry, I should say types of abstracts. Descriptive abstracts and informative abstracts. Descriptive are written before the project is completed. You just want to go to your mentor or your supervisor, and you tell them, Dr. Shad, I have this idea. How should I start my working on this project? And then I will ask, so please write a one-page abstract, what you want to do. And then I will see how can I help you, okay? So that's basically a descriptive abstract. Informative is written after a project is completed, which actually after the project is completed, then and then only you can add results, conclusions, and recommendations, right? So now I'm coming to one of the most important part, and this is the last section of this presentation. So I'm giving you an abstract example and how to divide it into various headings, which are very simple to understand and how they can help you. So this is a case report poster presented at one of the meetings, not APA. So I was supervising this resident when I was in Oregon. And she saw this very interesting case, and she actually created the poster on that case. So this was a case defining interaction between lithium and lisinopril and renal resilience in a patient with bipolar disorder. So you see, I'm giving you the headings here, right? So I can do can you see my arrow? No? Okay. So the first text is general statement. Remember, I told you start with a general statement. So the general statement in this abstract is, although the drug interactions between lithium and thiazide diuretics are well documented, we are introducing an idea, right? The problem is deficiency, right? I told you about deficiency comes next. Much less is known about the interaction between lithium and other antihypertensives, such as angiotensin converting enzyme inhibitors. So now you have a general statement, and now you have a problem. What is the solution? Here we present an interesting case of a patient with bipolar disorder who maintained a relatively normal renal function despite multiple episodes of lithium toxicity and the resulting renal dysfunction over a period of 30 years. And now you have the last sentence as the conclusion. You have the case came to our attention. This is not a conclusion, but a part of some description. This case came to our attention when this patient developed the most recent lithium toxicity with significant renal impairment, but only after the dose of lisinopril was increased. More importantly, the patient renal dysfunction resolved after lisinopril was discontinued and stayed relatively normal despite starting lithium at previous effective dose. So that's how you do it. Repeat it. General statement, the problem, how to solve the problem, what is the solution, which is the result, and then conclusion. If you follow this format, you have won half the battle. This was the poster. You see, I told you about the table here. Doesn't matter you have a case report. You need a table. Audience, look at the table. They want to understand the sequence of clinical events happening. What was the relationship? What happened in August? What happened in February? What happened in March? And on the first column, you have the dosages, the side effects, and the clinical picture. That's how it is done. And I think because of time, I'm going to skip other types of abstracts. But again, get peer feedback, please, because they are going to, sometimes they will tell you things which will say, how stupid I am to write this like this. And people, are guiding me excellently on, on the things I've done. As a matter of fact, you don't even, even before you get the peer feedback, if you write one thing today and you read it tomorrow morning, you will say, what BS I've written? Doesn't make any sense. And then you go on yourself and you try to improve. This happens all the time. If you're not doing it, it's not going to work. These are some of the software tools for analysis. I'm sure you are familiar with those, and I'll be open for questions.
Thank you very much, Dr. Shad, for this comprehensive session on abstract writing. So I can see in the chat, and few questions are there. I think for beginners, I mean, there is a question that's, if you do an abstract presentation, can you publish the paper afterwards?
Yeah, that's a great question. And it happens all the times. The line of sequence should be that when you write an abstract and when you write a poster, the next line is writing a review on that topic. That's how that's how the sequence is. You know why? Because writing an abstract, creating a table, creating, doing the literature search, makes you a scholar of that topic. And then that scholar knowledge which you develop after you review the literature and you write an abstract actually brings you in a very good position to write a review. So get the maximum out of your work. Don't stop at an abstract. End with the review, because that's low-hanging fruit for you. You already have worked. The legwork has already been done. Now is the time to write the review and optimize your CV. And the researchers and the interviewers will be extremely impressed that you start at a scratch, at the basic, and then you developed an abstract and poster and then got published. Man, there's nothing impressive more than that. But the question, if the question is that if the paper is published around submission of the abstract, that's fine. Lot of people do that. You can, actually our paper before the APA abstract date was already published. But you can then proudly say, oh, by the way, this paper is published now. You can go at this link and see it. You'll feel so good about yourself, right? Did I answer the question?
Yes, thank you very much. There is another question that, is there a difference between poster presentation and abstract presentation? I think the ethics need some clarification on presentation. Abstract, what do you?
So abstract is usually not presented. Abstract is a part of a paper, as I said. Abstract is a part of a review or meta-analysis. Abstract is a part of a poster. So abstract as such cannot be presented by itself. It's part of a larger project. So abstract, just like the name say, is abstract, is not concrete. It's just your ideas on a piece of paper where people can see where are you going with this. So if they are interested in reading your poster or your research paper or your review or your meta-analysis or your case report or your case series and reviews, okay? So abstract by itself may not stand alone, although there are a lot of conferences and meetings which publish a book for the abstract, but that is only published if your poster was accepted to be presented.
Thank you. So Paris, can you please unmute yourself and ask your question? Okay, so Paris asked the question that as for abstracts, we have to complete with our research work first. So why we are opting to present poster in form of abstract than the poster of complete research?
Can you repeat that question, Fauzia?
So the question is that for abstract, we have to complete with our research work first. So why
No, you don't have to.
Yeah.
You don't have to, because I said in my presentation very clearly that there are two types of abstracts. One is informative and one is descriptive. You write the descriptive first to get an idea on the piece of paper by free writing. And then the informative is the one after you finish your review, for example, and then you write down that abstract with the results and conclusions and methods, okay?
Imad Hussain, no, Amjad Hussain, can you please ask your question?
Yeah, sure. Thank you very much, Dr. Fauzia. I just wanted to ask, like, abstract is basically face of a whole research endeavor. Like you're writing a whole paper and you just publishing an abstract. So it's just kind of like a snapshot analysis of what you are trying to do. So I was just wondering if, like, somebody gives you a research assignment and you just do it like in terms of interim thing, and you just submit to your mentor, and you don't think about publishing it. So can it be done? Can we do it like that way?
Why not think about publishing it? You have done all the legwork, all the hard work. You have done the literature search. You have written the abstract, and you have presented the poster. You have all the material to write a research paper or a review paper. Why not? Am I understanding your question well?
Yeah. That's what I was. That's what I wanted to ask. Like, if
Yeah.
it's
Thank
just part of your assignment, like if somebody gives you that you have to like do some sort of research for a diploma
No,
or something.
yeah. So your mentors will tell you that abstract is just the beginning. It can end up as a review paper published in a good journal. Okay. And if they don't tell you, I'm telling you. Okay, because sometimes they may not tell you, and they all depends upon the mentor who's sincere, how sincere the mentor is in telling you about the best way you can use your hard work to represent yourself and get increased chances of getting into a residency, because that's all what it matters. The only there are, I gave a presentation on how to optimize your application for residency. And I, at that time, said that there are modifiable factors and there are non-modifiable factors. So writing scholarly activity, optimizing your CV, doing research, publishing papers is extremely the best modifiable factor you can have. One of the best. And that you cannot imagine a person like me how valuable research experience and writing and scholarly activities for me. And this is true for a lot of residency program directors. They may not be researchers, but they are impressed easily with this kind of work.
Thank you very much. Atika Hashmi, can you please unmute yourself and ask your question?
Yeah, thank you. Assalamu alaikum. Am I audible, please?
Yeah.
Yeah. So, sir, I wanted to ask is that when a research poster is accepted by a conference, does it necessarily mean that it is going to get published? Or, I mean, is it a conference specific?
No, there's no confirmation that a poster is accepted to be presented, will be published as a paper. You have to elaborate on it. You have to write the whole paper, and the journal you're thinking about, you need to go there, look at the author's instructions, and see what is the format. For example, there is a different format for a case report as opposed to a systematic review, for example, or a meta-analysis. So then the more elaborative work starts. Now you have all the groundwork, you have all the basic information with you based on the poster, but then it is going to require some work to develop the paper from it. But let me tell you, there are some conferences, I said earlier, they actually can only publish the abstract in a book, but that is not as important as publishing a whole review in a journal.
Yeah, thank you so much.
You're welcome.
Thank you. Now, can Dibankar Day, can you please unmute yourself and ask your question?
Hello, can you hear me?
Yes.
Yeah.
Thank you, sir, for the informative session. I had one question. So I brainstormed a few topics for meta-analysis, and what I found that exactly the type of research question I was seeking, it was previously answered in a published paper like 2016 or 17. So will it and after that we have a couple of large observational studies or trials that can be included in the meta-analysis. And if we include all those trials or observational studies apart from all those previous, like before 2017, it might not change the conclusion of my meta-analysis of the specific question answer that I'm seeking through the research question. So, like, is this kind of research question is it likely to be accepted at any of this conference? I mean, I'm talking about simple binary outcomes. Like,
no, I understand what you're talking about. I think this is a very common question, and my residents always ask me, Dr. Shad, the idea I discussed with you, there are a lot of already meta-analysis reviews and recent papers, and how can I be guaranteed or be sure that this paper is going to be published, because there's so much available, right? So this is a very important message for everyone who's attending this presentation. Never give up because a lot of things have been published in an area. Never. I guarantee you that if you review the literature, you'll find something which you can improve. There's always room for improvement. And you said it yourself. There are a couple of new studies, large size observational studies available. So you can add them, if not anything else. You know, I write critical reviews all the times. And that is something you can do. You can analyze, and you can see the deficiencies. There will always be. There's no perfect paper. Even your paper will not be perfect. My friend, there's always room for improvement. Don't even think about that somebody has done this, I cannot do this. That's not an excuse. Okay.
Thank you very much. Thank you.
Thank you, sir.
Yeah. Now, try Vikram. If I'm pronouncing right, can you please unmute yourself and ask your question?
Hello. Hello, sir. Am I audible?
Yeah.
to you? Yeah. So my question is it advisable to go for an abstract presentation even after the process of publication is not quite in our way? I mean, we might think there might be some changes needed to get it published, but still, can we proceed to go on for the presentation?
Yeah, you can. So that's a great question, because what you are saying is that if you, before the poster presentation, you had some new findings, or maybe the completion of the study, and your findings changed, that's perfectly all right. What you can do is, when you're presenting the poster, you can inform the audience verbally that, look, this is what we found, and we are working on this manuscript, and it will have some differences. And what are the differences? You will tell them. So there's no problem in still presenting the poster, as long as you tell the audience there's some new exciting developments which I need to inform you verbally now, but they will be published in the paper we are working on.
Thank you, sir. Thank you so much.
Hello, am I audible?
Yes, we can hear you. Please speak loudly.
Okay, sir, I have a question, maybe not regarding this abstract. If we have done all the USML exam and planning to do residency or finishing residency and want to do some other degree like master or PhD, to learn the research effectively, what do you suggest, MPH or MS clinical research?
Yeah, so I'll be biased. You asked a question which I am also a master's in clinical sciences, which I did when I was at UT Southwestern. Yeah, so I think both are okay. But since I have experience with the MSCS, which is the Master of Sciences in Clinical Sciences, I found it very, very helpful, because it primarily is associated or linked with, or it trains you on the statistical designs, epidemiological studies, randomized controlled trials, and I was really lucky to get a good mentor. As a matter of fact, in future, I'm thinking about communicating that course I attended at UT Southwestern. It will be several presentations, but the way Dr. Milton Packer was our course director, who presented most of the topics, is just one of the best I've ever seen. So I want to communicate that to younger people, that that's how you learn research.
Okay. Thank you, sir. Thank you so much.
Yeah. Okay. It seems
Abdul,
like
no, there is one more question. Dr. Shad,
okay.
I'm sorry, and this would be the last question. Abdul
Okay.
Dada, can you please unmute yourself?
Yes, thank you. And thank you, Dr. Shad. Just a quick question, if you guys can hear me. I was
Yeah.
wondering, Dr. Shad, what are the most common mistakes you tend to see in papers you review from students and residents?
Oh, you're talking about Vegas?
No, in general, yes.
Yeah. What kind of the mistakes you said, right?
Yes. What are the most common mistakes you've noticed that, tend to come up in papers from students and residents that we can learn from and be mindful of when we make our own papers?
So as such, nobody is perfect, okay?
Okay.
And there's never going to be a perfect application, to tell you first that, okay? But there are some mistakes. For example, I was just talking about one, that you presented a poster, it's in your CV, and the program director asks, what did you do? And you're looking around and don't know the answer, right? Or even if you know the answer, you don't know anything about the methodology. You don't know anything about how it was done, how many studies were selected, how did you review, what kind of a study was that, right? And also the discussion part, that how this is possible. Can you provide me some putative explanation or hypothesis of your findings? Then you really know that this person is just maybe superficially participated in that poster or abstract writing, and he actually was not involved, or the primary person, or even an important person of the poster. So that is one. The second is, I'll give you a journal, because because we can have another course on the mistakes potentially made by medical students or applicant. So I don't want to go there because this is the last question, but I'll give you one very basic advice. Just be yourself, be honest, be transparent, be clear, look enthusiastic, don't make up stuff. If you don't know something, simply say, I don't know, but if you give me a couple of minutes, I can think about it. Don't respond reactively in response to a question you don't know anything about at that time. But think about it. You'll be surprised how many good answers will come to your mind if you take your time. And there's no problem. Program directors will like, this is not a reactive person. He thinks about stuff. I'm just giving you one example. But I think you need to, I'm sure you have seen some of the sessions from PAPANA on how to interview and all those things. Please look at them if you have not already. They will give you better answers because we don't have time to discuss elaboratively. Okay.
Thank you, Dr. Shad. Really, I think
Yeah.
you answered my question perfectly. Thank you.
Yeah. Okay. Thank you, everyone. Really, really appreciated that you guys come on a weekend and listen to this talk, which sometimes can be boring because I know there's a lot happening these days. You have so many presentations going on, but thank you so much. And if you have any questions, let Fauzia know, or you see me on the PAPANA website as well, so you can directly let me know. Okay. Thank you so much. Have a great rest of the Saturday. Bye-bye.
Thank you very much, everyone. We will be
Thank you.
sharing the recording of this session, and you can then later on join us on our PAPANA research group, and we will be sharing the link for and the flyers for our next sessions. Thank you very much for your time. Thank you. Bye-bye.